Good morning, I'm Matt Schaffer. Welcome back to the Boston Sunday Review. What is a clinical massage and who can benefit? Drew Freedman owns the Boston Bodyworker in Copley Square. He joins us this morning here on the BSR. Good morning.
Good morning, Matt. Thanks for having us.
So what is a clinical massage?
Well, a clinical massage is really, it's a comprehensive blend of evidence-based massage methods that they specifically cater to injuries and common pain patterns that occur in the human body. It's designed to help the body do what it really does naturally, which is repair itself. So a clinical massage is best utilized when it's received on a consistent basis. So depending upon the amount of wear and tear you put on your body, that's kind of how often you want to be receiving a clinical massage.
How does it differ from a therapeutic massage?
Well, I mean, therapeutic massage and clinical massage are pretty similar, but a clinical massage is really, the main difference is that a clinical massage is designed to match the physiology of the injury with the physiological techniques of what's being delivered from the massage. So, for instance,
explain.
Yeah, for instance, if you come into my office and you have a pulled hamstring, okay, I need to know as a clinical therapist what you have going on, and I'm not just going to dig my elbow deep into your hamstring. I need to apply the right technique, say sports massage, to address that pulled hamstring. So I'm not going to go in deeply. I'll do some cross-fiber friction work on this, some gentle stretching, but if I dig my elbow in there and just did deep tissue work, it's probably going to aggravate the injury.
How does it differ from Swedish massage?
Well, everybody loves a Swedish massage. It's nice and relaxing.
What is a Swedish massage?
Well, Swedish is what you get over on Newbury Street. It's a nice little spa massage. It's what I always say to people. It's if you want a good Swedish massage and you feel good for that hour, but the rest of the day you still got to go back to your life. A clinical massage, you feel like hell for that hour. It's sometimes a little painful, but for the rest of the day you feel fantastic, and sometimes for the rest of the week.
How does it differ from Thai massage?
Thai massage would be classified under the umbrella of clinical massage. Thai massage involves a lot of movement with your body work, so the therapist sometimes gets on the table with you and takes your limbs through a range of motion, but at the same time is applying pressure to different muscles as well. So it's under that umbrella of clinical massage.
How does a clinical massage differ from Shiatsu?
Again, clinical massage is everything is all-consuming underneath that umbrella. If the massage is designed to assist with an injury or a pain pattern in the human body, it would be clinical.
What is Shiatsu?
Shiatsu is basically dealing with the different pressure points and meridians in the body.
How does a clinical massage differ from Reiki?
Reiki is more of what they call energy work. Okay, so Reiki is a lot less invasive, involves just some light touch and moving some energy through the body. So, again, has a therapeutic effect, but you probably wouldn't find too much Reiki going on at the Boston Bodyworker.
And a back rub?
Back rub's what your girlfriend gives you, or what you're supposed to be giving your girlfriend, but you're too tired to half the time.
What is trigger point therapy?
Without getting too scientific on it, basically what happens is that within the muscle, you develop a small little spasm within that muscle, and trigger point therapy is designed to find that little nodule and press directly upon it, and sometimes when you press on it, it can radiate pain to a different area of the body.
For every muscle?
For every muscle? No. I mean, as humans, we all develop similar trigger points in our bodies based upon our common, lifestyles. But not every muscle will have a trigger point in it.
So do most of us have similar trigger points?
Yes.
And where would we find them in the body?
Well, everybody has them tight in their shoulders, right? I mean, technology today has kind of steered us into that realm of everybody's kind of doing the same thing where they're hunching forward. So in the middle of your back, between your shoulder blades, in your traps next to your neck, you'll have them. If you're an athlete, or if not an athlete, you're sitting for a prolonged period of time, you get them in the middle of your hamstring. So you get them in and you'll feel it. When that pressure's found, you put that direct pressure on it, you'll feel it. All of a sudden it'll be like a zing. And oftentimes it will radiate to an area absent from the direct area that it's in.
Myofascial release. If I'm not sure I even pronounced it correctly.
It's called myofascial release.
Okay. It's MYOFASCIAL.
Correct.
Release. What is that?
Myofascial release is a combination. Myo it means muscle, and fascia. Fascia basically is, I use it as an example, if you pull the skin off a piece of chicken, that white film that's over the muscle and the meat of the chicken, that's fascia. We have one continuous connective band of fascia that runs throughout our entire body around organs. But as it speaks to muscles, that fascia wraps around muscles and almost kind of encompasses the muscle and can get tightened down on top of the muscle. So myofascial release would involve the spreading and light spreading of that fascia to allow the muscle to breathe more.
Craniosacral therapy.
Again, falls into that realm of the energy work, okay, where it involves light touch and involves the movement of the cerebral spinal fluid up and down the spine. So cranium meaning your head, sacrum on the sacral in your lower back is going to involve this fluid moving throughout continuously through your spine.
Deep tissue work.
Buzzword.
For
a better massage, I guess. You know, I mean, deep tissue is all relative. You know, I see people come in all the time. They say they want deep tissue, and I ask them if they know 3 other types of massage therapy, and typically they just know they don't want Swedish. They want to make sure that somebody's actually going to be pressing down. So deep tissue work would really involve, you know, working superficially to deep and getting into those deeper layers of muscle tissue as you kind of slowly work through the massage.
And when we're talking about the broader idea of muscle energy techniques, we're talking about
muscle energy technique is actually falls under the clinical massage umbrella. Even though you get that word energy in there again, it's not necessarily energy work from the I don't know, from the visceral sense, I guess you would say,
or the spiritual sense.
So muscle energy work involves having the muscle contract, and you hold it in an isometric contraction for a little bit, then you relax and you stretch it out, or you have some resistance as you're stripping through a muscle. So that involves the muscle energy. The muscle's actually activated while the therapist is doing the work.
And so basically what you're saying is that the therapist is essentially manipulating the muscle at that point.
It's manipulating the muscle as the muscle's engaged. Commonly in a massage, you're laying there on the table and you're a passive subject on the table. With muscle energy work and several other types of techniques for clinical work, you're oftentimes asked to engage a muscle or bring your arm through a range of motion, we'll say, if you're working on the shoulder. So there's some engagement of the muscle at the same time, which makes it muscle energy work.
And I'm just curious, for when we're talking about the difference between clinical massage, and we've been mentioning some of the so-called quote-unquote energy, like Reiki or the energy things, do you nevertheless notice, being a clinical massage therapist, do you nevertheless notice some difference in the energy of people while you're doing what you're doing?
You mean, do I physically experience it?
Yeah.
Absolutely, you do. Because, you know, when somebody comes in for a massage, you're stuck between 4 walls with somebody. So there's definitely a personal aspect to the work that's being done. So the energy that's kind of being transferred between the two is very important. So we always say to our therapists, when you're in the room with your patients, you need to be present, meaning that you can't worry about what's going on outside the treatment room, and be present with the patient that's in the room. And if you are, that energy is always a stronger one.
What kind of conditions can clinical massage address?
Well, what we commonly see in our office are conditions of myoskeletal and musculoskeletal conditions, such as like a hamstring pull. You can have irritations to the rotator cuff. You know, with the marathon season come up, we see a ton of shin splints coming through our office, hip injuries. It really depends upon each condition, but clinical massage is such a wide umbrella of different techniques that it can really address a vast majority of injuries that happen out there.
Do you need a doctor's referral?
No, not at all, actually. We offer a health insurance discount, but you can come in on your own. It's out of pocket, which is what I kind of like about our practice, is that when the people are coming in, they're usually coming in with a problem, but they're being proactive about their therapy because insurance doesn't cover this, so they're paying out of pocket. So we really want to try and get them out the door as fast as possible.
Do any medical conditions preclude massage?
Tons. Tons of them do. A therapist needs to be well aware of any contraindications before giving a massage. Again, you come into my office with a hamstring pull that you suffered playing flag football out there along the river, and you got a big abrasion over the top of your hamstring as well. I'm not going to be stripping through there working on an open wound. And, you know, there's other conditions if they're on different medications, blood thinners. You wouldn't necessarily not do massage, but you have to be careful of the amount of pressure you're applying when doing